Post-operative phase. Stay in intensive care. Following your cardiac surgery, you'll be brought to the intensive care unit for a period of 12 to 48 hours. Please note that this period may vary depending on your condition after surgery. For your safety, when you wake up, you may be in restraints. This will stop you from removing your tubes or trying to get up in confusion. During your stay in the unit, a team will take care of you. A nurse will remain at your bedside during the first hours after surgery, and a doctor will always be on hand in the unit if needed. You will be in an open room where the nurses can see you from the nursing station. The surgeon will visit you every day. During this period, several devices and instruments will be set up to take measurements, administer medication or blood, drain fluids, and so on. Here are their uses. Cardiac monitor. All patients admitted to intensive care are hooked up to a cardiac monitor by wires. This device relays information on your heart function, arterial pressure, temperature, and other measurements that will help to evaluate your condition. Epicardial electrodes. During the operation, electrodes, little blue wires, are placed on the surface of the heart and come out of the chest. They are left in place for a few days and hooked up to an external pacemaker to accelerate your heart as needed. IV fluids or IV solution. Various types of fluids are administered intravenously, such as solutions or some medications. They are hooked up to pumps that help to administer them regularly in a well-controlled manner. Catheter. This goes into the jugular vein, the big vein in your neck, and descends to your heart. It serves to take various measurements and to administer medication. The catheter may be uncomfortable when you try to move your head. Arterial line. This is a very thin tube inserted into the artery in your wrist, enabling arterial pressure to be displayed on the monitor. It is also used for blood draws. Respirator and oxygen mask. The respirator is used when a patient can't breathe on their own as a result of anesthesia. It sends air and oxygen into the lungs through a tube that is usually placed in the mouth. Normally, this tube isn't painful, but it can cause irritation. You will be weaned off the respirator gradually as soon as your condition permits. The tube will be removed and replaced by a mask or nasal cannula, which will provide you with supplemental oxygen. Usually, this tube is removed the day of the operation or the next day. Oxygen saturation monitor. A small rubber clip is placed at the end of a finger at all times and is connected to a monitor that measures the oxygen levels in your blood. Drainage tubes. These serve to remove certain fluids from the body. The gastric tube drains fluids from the stomach to reduce nausea. It goes through the mouth and is removed after extubation. The urinary catheter is inserted up to the bladder, enabling your renal function to be monitored and allowing you to urinate. You may feel the urge to urinate. This sensation is caused by the catheter. Chest tubes are inserted into the chest to drain the blood that may accumulate there after the incision is closed. They will be removed when the fluid stops draining. These tubes are kept in place by a suture and a large quantity of adhesive tape. You can move without worry. Don't be startled if one of the devices makes a noise. The professionals will take care of it. Some of these tubes may be uncomfortable, but they will be removed as soon as your condition permits. You'll receive analgesics to relieve your pain. To learn about these devices and instruments again, consult the brochure that will be given to you. Your breathing will likely be limited by pain and the secretions that may accumulate. Once you are taken off the respirator, you must use the spirometer to clear your airway. Once the gastric tube has been removed, upon extubation, you will be served a liquid diet. After this, you'll gradually return to eating normally. Intravenous infusion or solution continues until you begin eating normally or as long as you are receiving intravenous medication. The tubes, wires, electrodes, and catheters are usually removed in the intensive care or cardiology unit, depending on the progress of your condition. Most of the time, the dressings covering your wound are removed as soon as the draining stops, which is usually 24 to 48 hours after the surgery. Stay in the cardiology unit. At the end of your stay in the intensive care unit, you will be brought to the cardiology unit for the rest of your convalescence. Depending on the type of surgery and your progress, you'll stay in the unit for 4 to 7 days. The physiotherapist will visit you throughout your stay to help you. A cushion will be given to you, and the physiotherapist will show you how to use it. This cushion will protect your rib cage by limiting the use of your arms when you move, cough, or sneeze. You should keep this cushion over your wound or use a pillow or rolled up towel to reduce pain at the wound and promote healing. You should also continue using your spirometer. You'll also do simple exercises with a physiotherapist, taking into account your abilities, such as sitting on the side of your bed, getting out of your chair, walking, climbing stairs, and more. You'll be encouraged to move as early in your recovery as possible to avoid pulmonary complications and thrombophlebitis. The cardiac surgeon and the specialized nurse practitioner will visit you every day. The nurse will ask you about your state of health, perform a physical exam, and adjust your treatment in collaboration with your cardiac surgeon. In the brochures we give you, you'll find various techniques to learn more about improving your breathing, reducing pain, doing your exercises, and more. It is very important to use the techniques presented in these documents. Medication and pain. There are various ways to administer medication to relieve the pain associated with the surgery. Intravenously, i.e. directly into your veins via solutions, in the first 24 hours, injections, suppositories, and pills. In general, sedatives are not given automatically. Don't wait until the pain is too intense to request them, as this will make them less effective. It is very important to treat pain properly to facilitate your mobilization and thus prevent complications. The doctor and nursing staff will work with you to make sure you are as comfortable as possible. To reduce your pain and increase your comfort, you can use a cushion to protect your wound when you cough. Take frequent rest periods if the pain is more intense. Position yourself comfortably, sleeping or sitting. Avoid tight-fitting clothing and maintain a calm environment. Your discharge. If your condition permits, you will be discharged from the hospital 4 to 7 days after you're transferred to the cardiology unit. Before you leave, a member of the professional team will meet with you and one of your loved ones to give you recommendations to follow during your convalescence. Your convalescence. Your convalescence will last approximately 3 months, and you will return gradually to everyday activities. After the operation, it is normal to feel muscle pain and stiffness for a period of 6 to 8 weeks. A prescription for painkillers will be given to you when you are discharged. Don't hesitate to take them as prescribed. When your prescription has run out, you can take Tylenol as needed. It is normal to be constipated as a result of the analgesics and the operation. A prescription for a laxative will be given to you when you are discharged. Don't hesitate to take it as prescribed. The swelling in your legs and ankles may take several weeks to disappear. To reduce the swelling, you can elevate your legs on a stool when you are sitting, uncross your legs when you are sitting, avoid standing for too long, walk, and avoid wearing fitted clothing. Additional information on the main side effects caused by cardiac surgery can be found in the brochure. If the swelling in your legs is increasing instead of decreasing, During your convalescence, you should consult your family doctor or go to the emergency room. You can also contact Info Santé by dialing 811. Recommendations to follow during your convalescence. During your convalescence, you may walk, go to the movies or a restaurant, go shopping, or ride in the car as a passenger. However, you must be careful when using your upper body or your arms. It is very important to avoid applying force with your arms while the sternum is healing. Many people are rehospitalized because they don't follow this requirement. Physical exertion. You should not lift, push, or pull heavy objects. During the first 6 to 8 weeks of your convalescence, you cannot lift, pull, or push loads greater than 10 pounds or 4 kilograms. For example, you cannot lift an infant or a grocery bag, push a lawnmower or furniture, or shovel snow. You should not use your hands to support yourself. For example, you cannot support yourself on a railing, piece of furniture, cane, or walker. It is essential that you respect this restriction to enable your sternum to mend properly and thus keep it from separating. If you hear or feel a cracking in the bones of your rib cage, you should contact us or your doctor. You should also follow these recommendations. Personal hygiene. During the first 6 weeks of your convalescence, it is important not to take a bath, scrub your wound, apply creams, lotions, scented products, or ointments to your wound, unless they are prescribed by your doctor. Once your dressings have been removed, you may take a bath, but you should not direct the jet of water towards your wound. To wash your wound, use a washcloth and soap to pat it. Other recommendations. It is very important to read the brochure that we give you to learn more about all of the recommendations to follow for returning to normal activities such as driving a car, sleeping, sexual activities, taking a trip, and returning to work. Lifestyle. It is important to maintain a healthy lifestyle by being physically active, eating a healthy and balanced diet, and quitting smoking. At the end of your second month of convalescence, you may gradually return to your activities. For example, you can start using your arms to lift grocery bags, or any other activities that require more effort from your arms. In most cases, you will have no limitations after 3 months. Medical follow-up with your family doctor. We recommend that you meet with your family doctor or referring doctor 4 weeks after your operation. They may adjust your medications based on your state of health. Medical follow-up with your surgeon. You'll also have a medical follow-up with your surgeon 1 to 2 months after your surgery. You will be given the appointment date when you are discharged from the hospital. The day of your appointment, you may need to undergo certain exams or blood tests. In-home follow-up. When you are discharged from the hospital, we will make a request for in-home follow-up. A nurse will contact you to organize the visit. They will come to your house to provide the necessary care for your condition, i.e. drawing blood, changing dressings, and monitoring your vital signs. Signs of complications to watch for. Some complications can occur after your surgery. Go to the nearest hospital's emergency room if you experience any of the following symptoms: unusual or irregular cardiac rhythm, palpitations, dizziness, chest pain that increases when breathing in, difficulty breathing, pain even after taking sedatives, chills, fever, i.e. your oral temperature, taken by mouth, exceeds 38 degrees Celsius or 101 Fahrenheit for more than 24 consecutive hours, or syncope, i.e. a brief loss of consciousness, a few seconds to a few minutes. Other problems that may occur during your convalescence. If you experience one of the following problems: hearing or feeling a cracking of the bones in your rib cage. Changes to the wound that persist for more than 24 hours. For example, your wound is red, swollen, or oozing. Or swelling of the leg that persists after 10 to 10 weeks. Contact the cardiology team at 819-346-1110, extension 15002. Most of the time, you must leave a voicemail message. They will return your call within 48 hours. If you are unable to call this number and you have concerns about your state of health, call InfoSanté at 811. Call your family doctor or go to the emergency room. We hope that this video has helped prepare you for your cardiac surgery. If you have questions or concerns, feel free to contact the medical team. You can watch this video again by visiting the CHUS's website at the following address: chus.qc.ca. Don't forget that you can also refer to the documents we give you to review all of this information.